Good morning, everyone. This is a joint committee session of the Health and Human Services Committee and Government and Operations Committees. We are here to receive a briefing and have a discussion regarding the status of our Montgomery County Health Officer position. Yes, if you all could come forward. Joining us in person today is Chief Administrative Officer Rich Manalino and Dr. Earl Stoddard, Assistant Chief Administrative Officer. And joining us virtually is Dr. Raymond Kroll, the Director of the Department of Health and Human Services. I'll just mention a few things up front, and then my illustrious co-chair here, if she'd like to say a few words, can certainly do so as well. But needless to say, the stature and the importance of this position has always been important, but it has taken on new meaning over these last 3 years. And our public health officers across the country have just done an extraordinary job in trying to ensure the health and wellness of all of us. Public health is one of those issues that is the core to everything that we do, but doesn't often receive the attention that it deserves, because we often don't worry about it collectively as a community. But what the last 2 years has taught us is the importance of positions like this to help coordinate efforts, to help connect dots, to help connect communities that honestly have life or death consequences. This has been new charter territory, and we know that our public health officers across the country have been under siege. And for those and many other reasons, this position has been difficult to fill. I want to acknowledge up front and express our deepest appreciation to Dr. James Bridgers, who has more than ably led our public health team through some of the most challenging public health times in the history of our country, and I believe seamlessly helped continue the work that Dr. Gales had laid the foundation for over these last year and a half. But it is unfair to Dr. Bridgers that he has had to essentially perform two jobs this last over year now. And so we know that this has been of utmost importance and urgency to the administration. We know that all steps have been taken to help fill this critically important vacant position, but we have not been able to do so. And so it did also bring up within the course of this conversation the discussion of what this office should look like moving forward, particularly with the lessons learned over the last 2.5+ years. And so we are here to have that discussion and hear from the executive branch what their thinking is at this point. While we are not prepared to make an announcement, we know that we will hear the status of the search of the position, and this council is very open to and wants to be a strong partner with the executive branch, because we are on the same team to help ensure the public health of all of our county residents. So we appreciate the opportunity to have this conversation today. I'll turn it over to the chair of our Government Operations Committee, Councilmember Navarro, to see if she'd like to make some opening comments.
Thank you, Mr. President, and thank you all for coming here this morning to have this briefing. I can't help but think back when the late Dr. Tillman would come and give presentations to this council, and at that time we would be discussing things like Zika and things of that nature, and she was always great bringing props and there were things that we needed to monitor, obviously, and there were a lot of issues that she would advise us, and it was always so important. Needless to say, the pandemic absolutely has just shifted entirely what that position is responsible for and what we all collectively have to do. And so I do have to thank the team, because between Dr. Gales and Dr. Stoddard, Dr. Bridgers, Mr. Medalino, the entire team, everybody had to kind of pull together to respond to something that was completely different, and everybody did their part. However, I think, as Council President was saying, going forward, we do have to rethink what this position is like. Is to me, I keep thinking about how, as we are right now, keeping everyone in our prayers that is facing this Hurricane Ian in Florida. Unfortunately, things like climate change, but then also these issues of, possible health emergencies may not just be like one-offs anymore. And so figuring out how we can attract the best talent, understanding these challenges of what it has meant to be a health officer during that time, figuring out how we can be creative, I think will really help us all. And because again, unfortunately, I hope we don't ever have to face anything like we have had to face in the last 2 years. But it looks like, we need to shift in terms of how government responds. So I look forward to hearing what the updates are and hopefully how, we can address this issue promptly. Thank you.
Thank you so much. Well said. And I do also, of course, want to acknowledge Dr. Raymond Kroll and his leadership of the entire department, because this has been a united effort, and his efforts to lead his team have been critically important. So with that, Ms. McGuire, I'm going to turn it over to you to just lay the foundation for this discussion, and then we'll turn it over to Mr. Madaleno and Dr. Stoddard to give us an overview from the executive branch on the status of the search of the position, but also the framework of the office. And then colleagues, please text me if you have a question or comment that you'd like to follow up on. But Ms. McGuire.
Thank you and good morning. So as has been described by Chair Albornoz and Chair Navarro, the overall structure of the public health leadership in the DHHS, and specifically with respect to the health officer, certainly has been the discussion that's been had at this dais over the last year during all the different iterations of this search. And what the packet does is just provide some information and context on the structures of public health leadership that are permissible under state law and are in place across the state and other jurisdictions. And so what we do see is that certainly there are requirements in state law that that there be a medical officer, that individual be a physician, but the configuration of how many positions lead public health and what the individual makeup of requirements are for each position can vary, as long as certain core requirements are met across the leadership structure. And so again, we just tried to provide in here some of that context and background information to undergird this discussion. And certainly the primary outcome of today is to understand from the executive branch what the proposed structure is going forward. Even in the history of Montgomery County's public health office, there have been different structures. There have been as was referenced, Dr. Tillman and Dr. Gales were both the health officer and the chief of public health, but there have also been times prior to that when there was a separation of those duties. And so again, just looking at what is the most effective structure for public health leadership for Montgomery County, and I know that certainly has been the subject of deliberation within the executive branch, and certainly wanted to bring that conversation to the committees today.
Thank you. So with that, we'll now hear from Mr. Madaleno and Dr. Stoddard on the status of the search of the position and anything you'd like to share that's relevant.
Thank you very much, Mr. President. If I may have a second, I'd like to start by wishing Councilmember Rice a belated happy birthday and welcoming him to my decade, where we'll have a little bit of an overlap. And I look forward to hearing about the White House conference that you attended. Not everyone gets to go to the White House for their birthday, so. And then just want to reiterate to everyone, remind people for full disclosure purposes that my husband, Mark Hodge, for the 21 years he's been a county employee, he has spent the vast majority of it within the Division of Public Health, serving in a variety of senior executive roles, and is currently the Senior Administrator for Public Health for School Health. So with that, I'm pleased to let you know that we are moving forward with a proposal which you will be getting in a variety of pieces over the next few weeks, because this is an unusually complex position, because not only does it appear in county law, it appears in state law. So recognizing some of the comments that you made and that Councilmember Navarro made in her opening comments about the role of a local health officer, we are going to be breaking the two roles into two different responsibilities and positions. We are going to have a health officer, a licensed physician who satisfies the state requirement of that person as a local health officer who will serve the county as the chief medical officer, recognizing that, as both Councilmember Navarro, Councilmember Rice, in their distinguished careers on the council have talked about the social determinants of health, advocated for a variety of things that we could be doing around expanding access to health care in the county. The county executive firmly believes that having someone serve in that sort of a role, a chief medical officer, to work on those issues, in addition to the local health responsibilities when there is an outbreak, whether it be a small outbreak of something or a massive global pandemic, that chief medical officer position would be held, would be satisfied by a licensed physician meeting the state law requirements and providing guidance to the county executive and to all of you moving forward on health policy issues. Recognizing, too, our unique structure within the state of a combined Department of Health and Human Services that is entirely a county agency. We are going to have a separate division chief for public health services because in our system, public health is dealing with everything from Montgomery Cares to school health services to the refugee clinic to the HIV and sexually transmitted disease clinic, all these, the TB clinic, all these different programs. So we are going to nominate Dr. Bridgers to be the division chief. He has done an outstanding job. I think we've all benefited from his leadership and certainly his management skills. It is going to take a few steps to get there because county law does intertwine these positions. And so we'll be moving forward with a change in the code to reflect the status of a separate division chief. We are working with the county attorney's office already to do that. So you will be getting a proposal to move it along. So I wish I could be handing you a packet that said Dr. Bridgers as chief, but it will take a few steps for us to get there. But hopefully you will agree that he is worthy of the position and of keeping his skills on behalf of the people of Montgomery County. We do have a chief medical officer candidate. That person has gone through their first interview with the state. They will have a second interview. We're not disclosing the name of the candidate because that person, of course, is currently employed by somebody else, and out of deference to their situation, we're hopeful the state will make a decision quickly, and we will bring that information to you so that you can move forward with this position as well. So that's the recommendation of the county executive. I think will serve the community well to have these two positions, and I think the Dr. Bridgers and the candidate, knock on wood since we've been to this point before, the candidate for the chief medical officer position will also be a valuable addition to the county government and to the community to help lead many of the issues that we know we need to accomplish over the next few years. So I know this has been a long process. I think at a certain point, I had hoped that we would be able to send over lots of names on June 30th, when at one point I thought the primary would be done on June 28th. Unfortunately, the primary was later, and then the count went later and later. So here we are a little bit later in the fall than what we had anticipated. But the county executive, I think once we got into calendar year 22, was very cognizant of the fact that, he was not like any of you. He was not assured of reelection and wanted to make sure that either he waited until we got past certain milestones to make nominations, or left that to a successor to make these decisions. So, but I think we feel comfortable moving forward with all of these changes now, also recognizing the importance that an individual serving as the full-time health officer makes while we are still dealing with the repercussions of COVID. So with that, I think Dr. Stoddard has a few things to add.
Just a couple comments. I do want to offer Dr. Kroll the opportunity. Obviously, he is the department chief, so I want to make sure he is the department director, so I want to make sure he has the opportunity to comment as well. There was a couple things I wanted to add and give some perspective on why we believe this change is important, and number one, but also number two, the recognition that we will need to work with this council to effectuate these changes. We recognize that, and we want to be a partner, as Council President Albanese alluded to. We want to be partners with you all in making all these changes, and so this will not be done in a silo. I think before the pandemic, and many of you may recall this because I think we were in the 5th floor conference room in this building talking about a meeting on health and all policies. It was a meeting focused on how we expand the role of thinking about health into everything that we do. We had a briefing in this room about a week ago on Vision Zero. There's an opportunity, as the council alluded to incorporate the health collaboratives, so the health initiatives, in how we message to the public about Vision Zero. It is the belief of the county executive that we need our health officer to be available to us to serve as a chief medical officer for all of county government, thinking about things from Vision Zero to gun violence to food security to access to health care to health equity, and having them be focused on the policy initiatives that we need to enact across all of county government, whether it's in the Department of Health and Human Services, but it's obviously much farther than that. There are going to be intersections with the police department, transportation, and the like, as well as our external partners across the nonprofit, private sector, our hospitals. All of those partners are such key partners in how our residents receive their health care, receive access to services, and make sure that those services are being provided equitably. And so it is the county executive's belief, very much so, that freeing up from the oversight responsibilities that are incredibly important and incredibly necessary from the Chief of Public Health Services will allow the health officer to be involved in many, many more things and be able to make a more global change across county government that will really bring home that health in all policies conversation that we had before the pandemic, that the pandemic has only served to highlight as being so much more important. Furthermore, the county executive has been very clear about this. He believes Dr. Bridgers has done an exceptional job. He believes that he deserves the opportunity to continue the work that he has started as the Chief of Public Health Services. He has done an exceptional job of being very organized and keeping that division operating very well. I agree with the sentiment that was raised that it's unfair to Dr. Bridgers to keep having him do two responsibilities. It's been unfair to Dr. Kroll. It's been unfair to Mr. O'Donnell, and a lot of other people within public health services. This is obviously, as Chief Administrative Officer Madaleno referred to, been longer than any of us would have liked. But obviously, moving forward, we really want to make sure that we work with the council to effectuate this change, to give the space and authority and respect and through the process to Dr. Bridgers and to the new candidate that we hope to be able to send over the next couple of weeks. Thank you. I'll turn it over to Dr. Kroll.
Thank you. I have a couple questions and comments, and I'm going to turn it over to colleagues. So,
Council President, I don't know if Dr. Kroll had a...
sorry, Dr. Kroll.
Yes.
I'm still balancing the virtual thing, so my fault.
Good morning, Council President Albanese, and thank you. My apologies for not being able to be with you this morning, but I'm typhoid Mary today, so I think it is best for me to stay isolated and stay out of public for the moment. A couple of things, if I may. One is just first off to acknowledge what has already been said about the work that Dr. Bridgers has done over the last year, and indeed over the last several years in supporting Dr. Gales and his time as the health officer and chief, but also stepping into that role when it was necessary without really missing a single beat and taking us through what was the worst outbreak of the pandemic, and doing so successfully. I think what he demonstrates is the feasibility of doing the work in an integrated position where you've got both the health officer leading the county out of this and at the same time doing the necessary work of supporting a health team in implementing policy and practice. That said, I think that has always served the county well in past decades. However, to your point, Councilmember Albanese, that this pandemic, I think, is likely to presage some calming future epidemics, pandemics, emergencies. We're in a different kind of environment now. And that kind of intensity that we've seen in the last 2 years, I think, cannot be effectively maintained in a single integrated position. So the split makes perfectly good sense for the department's perspective, and I think for the county's perspective. The health officer has always taken a countywide approach in thinking about health. This frees them up to do that in a more wholehearted way, in a more holistic way. Both in terms of health, things like health and all policies that Dr. Stoddard mentioned, but also what I view as the important work of growing the integration between health and all the various human services domains across the department, which all tie into the social determinants of health and help to improve the social determinants of health for our county residents. The split recognizes that there's a future that is going to be different from anything we've ever seen, and this is a timely opportunity to do that. So the one thing I'll add about the current candidate is that the candidate has gone through interviews with my team in the health department, and has interviewed with the county executives team, and has gone through the first round of interviews with the state. They are in the process of scheduling up an interview with the secretary, and they are comfortable enough from their first round to go ahead and begin their state-required background checks for health officers. So that process is moving forward. They have indicated it will take about a week or so for them to give us for them to complete background check. No date certain yet as to when the interview with Secretary Schrader will take place. But as we know that, I will share that with you all, so everybody's kept us apace. With that, I will turn it back over to you, Council President Albornoz. Thank you.
Thank you, Dr. Kroll. I appreciate it. So just a couple questions and comments. So we've gotten pretty far down the road with candidates before, and unfortunately, we're at the 11th hour. Things didn't work out, and so what I know there are mitigating factors, but what degree of confidence do you have that with this most recent candidate that we're going to get over the goal line?
So I'll take a shot at that. This one I think is it feels categorically different. We've had conversations in session and conversations in interviews and conversations between interviews, and the candidate has expressed an interest in, quite frankly, either the joint position or the health officer position. I think the health officer position feels like more where their true interest lies. So, and at every step along the way, the person has continued to express an interest. And very little in the way of reservation. The things that we saw with previous candidates don't seem to be an issue for this person. It is a person who's lived in the county and works in the county, so I can say that much, I think, safely. So we are much more confident this time that this is one that is. I don't see any caution flags on the horizon to this point.
Thank you. I appreciate that. And I don't want to bury the lead. I think the split makes sense, just based on the workload and the framework moving forward. And I like the concept of the chief medical officer obviously working across, not just within the executive branch and county government, but sister county agencies. So I'm not sure who's in the best position to respond to this, and I know it's somewhat premature, but I would imagine some thought's been given into the intersection between Montgomery County Public Schools and some of our other organizations. But how do we envision that looking? What will that potentially look like?
So we are.
Go ahead. Sorry, Rich. Please.
With a large new administrative team at MCPS. Dr. Kapunen is relatively new. There's a new chief of staff. There's a new deputy superintendent. There are a lot of new people in leadership positions at MCPS. So we've been building a stronger collaborative effort on this. So ideally, our new chief medical officer will interact on a regular basis with their chief medical officer. And Dr. Stoddard, who's been taking one of the lead roles in the relationship between the two. I'm about to cough, so I'm not getting emotional here. But Dr. Stoddard can give you a little bit of background of, if you want, some of the things that we've been doing this school year with this new team of leaders at MCPS.
Yeah, just briefly, I think that'd be great.
Yeah, so it actually began really over the summer when some of these conversions were occurring, and actually the Criminal Justice Coordinating Commission did a briefing about this yesterday. There's been a lot of focus on school safety and student wellness as we transition, and thinking about obviously the expansion of the health rooms, and we very much appreciate the work of particularly Chair Navarro and all across the county council for recognizing the importance and really pushing the expansion of the wellness programs in all the schools. And so that's been a major effort. In the school safety realm, obviously there's been a lot of work and training between the security staff and the police department on school security, and this has been a partnership that is actually reaching over to include Health and Human Services for data sharing opportunities. And so there's actually a progress around an MOU between data sharing around student wellness that's being worked on. They were meeting yesterday. So we know those things are continuing to move on. And so obviously this has been across the board, thinking about reimagining student safety and wellness. Collaborative effort between the school system and the many executive branch agencies, and we expect that the incorporation of the health officer into that. I will also say, without referring too much to the candidate that we're thinking about right now, that candidate does have some ties and relationships to MCPS already, which is a good thing because they're coming in with some context and some knowledge of the system and the individuals who are playing a role in this MCPS executive team. So I think that will serve them well in terms of starting and building a relationship and understanding exactly what the relationship with MCPS will look like.
Thank you. Just the final is a comment. So this body sits as the Board of Health, and that has taken on new meaning these last 2.5 years. And clearly, there have been a number of lessons learned on this body as to the intersection between HHS, the public health team, and while we are discussing today the specific framework within the office and an update on the specific positions, we will need to have subsequent conversations and some hard work to make sure that we as a body moving forward are better prepared, in a better position, that it's much more clear how and when decisions will be made, because none of us are public health experts, and yet we wield a tremendous amount of responsibility, and nobody could have predicted that a global pandemic would have befallen us as a community. But we must prepare and ensure moving forward that we don't repeat some of the same mistakes that were made, and that we are not flying blind, and that is going to be a critical component of this. We will not have time to get too far down that road in this particular discussion, but we will need to have that discussion and are already beginning to have that discussion now. So with that, I yield to colleagues. I've got Councilmember Friedson, followed by Council Vice President Glass, and then Councilmember Rice.
Thank you, Council President. Really glad we're finally having this conversation. I know we had to delay it a couple times, or at least once. And appreciate the announcement today. I think it's a bit long overdue, but I'm glad to hear it. I suggested this months ago, and I think there's really good reason to do it. And I think it's important that we move forward. So the first thing I'd like to say is I want to echo the comments about Dr. Bridgers. Appreciate not only his work up to this point, but that in this split that you've already made that announcement. I think it's important to demonstrate that publicly and to show our support for his work and the work of the team that he is leading. And so I wanted to acknowledge that and appreciate that. I think this change is needed for a lot of reasons. I think it's one of several indications of the way in which we have to change coming out of COVID, learning what we have learned, knowing what we know, recognizing the challenges that public health departments faced before COVID, that were exposed during COVID, of how important they are to our everyday lives. And Dr. Stoddard, you noted a series of aspects of a health officer and a medical officer and how they could help in the various aspects of county government and county partnerships that the current structure doesn't really allow, because you have to manage the day-to-day operations and keep the trains running on time to deliver vaccines and to provide healthcare services and to make sure that particularly those most vulnerable in our community are receiving the care that they need and we need, by the way, because we talk about healthcare as if it's an individual care, but the whole concept of public health, as we saw during the pandemic, is that our neighbor's health impacts our health, our family's health, impacts other families' health, and so we need to make sure that we're addressing that. So this is good news. I want to acknowledge that and make sure that's clear. I do have some questions. I wish that we were here today talking about the legislative changes, and I think there has been sufficient time for us to do that. So I am a little bit disappointed that we aren't ready for that, but I hope that moves forward quickly. Do we have a general time frame? We had this discussion in May. We had the challenges in May. This was suggested in May, if not before. It's been consistently suggested since then. I actually sent a memo to colleagues, have had conversations with the executive branch, over a month ago. Where are we in terms of getting the legislative changes to make this split happen and to have the conversation at council to work through any of the legislative mechanics and to make sure that we can move forward? What's the timing on that?
Yeah, so the original class spec change were made, I believe, by the HHS team in June. I think it's stated June this year, around the mirroring the requirements of COMAR in the health officer position, which is largely to say that it isn't required to be a medical doctor. It can actually be a public health professional who's got 7 years of experience and three administrative management experience of a public health division. And so those changes were made in June. The larger changes to separate the health officer from the chief of public health services have to come in a couple different forms. So first off, the health officer class spec needs to be amended. That's actually already underway, and I expect it to be done this week, early next week. The more lengthy change is with the creation of there is a vacant question A position that's the chief operating officer in Health and Human Services. That position is going to be repurposed to become the Question A Division Chief of Public Health Services. That requires that a regulation change, which means that has to be posted in the registry, I believe, for 30 days, and that should be able to happen beginning next week. Once that occurs, we send it over to the council, and actually requires a code change. We're drafting the code change. The current county attorney is now, and so that should be ready long before the registry is cleared. And at that time, the intention is to send over Dr. Bridger's name as the nominee with the code change at that time. And so it will move forward very quickly. It's just there's some required waiting period for the regulation change through the registry that will impact, we believe, the exact timing of how it all comes over. But the health officer candidate should come over, hopefully, over the next, as Dr. Kroll alluded to, hopefully we can get the background check over the next week, and hopefully we can get the state to schedule the interview with the secretary over a similar time frame. But as soon as those two steps continue or conclude, we can send over the candidate nominee for the health officer position immediately. So I think it gives you some sense of there's multiple steps here that have to be worked through, but there is a process already in place, and we expect that absent the mandatory waiting or the influence that the state has on the process, that by the end of next week we should be able to have those things moving forward from our perspective.
And Dr. Stoddard mentioned the vacant COO position. I don't want anyone to think that Vicki Buckland has departed county government. The prior administration made a decision when Mr. Wilbon left, and they wanted to move Ms. Buckland into that position, assisting Director Alawalia, that Ms. Buckland's position was converted to an MLS M1 position. So she is still there. She is still the COO. But that Question A position that was affiliated with that still remains in HHS, and we will be converting. That's what Dr. Stoddard was talking about. That is being converted into the chief medical officer, no, the division chief.
Division chief that
position, that Dr. Bridgers
is going to
will occupy, because we already have the local health officer, chief medical officer position sitting there. So
thanks for the clarification.
So I just wanted to make sure no one thought that Ms. Buckland had departed.
So
she is not.
The change, Dr. Stoddard, that you mentioned in June, that change, at least my understanding of that change, was based on what you had shared in May, a few weeks earlier, that the county executive had just gotten it. You didn't know if he was ready to endorse it, but your thinking was potentially, possibly, not sure, but could change the health officer so it didn't have to be a physician. That was
Correct.
the change in June?
Correct. That
Which
was
is
the
not
class
the
specification.
direction that you're moving in now.
So we're going to leave that change in place. Now, obviously, the candidate that we have before us right now is a licensed medical. We left the flexibility, and we're going to leave the flexibility in the class spec because in some future hiring of some future health officer, we believe that latitude is important as well to not
So we
necessarily.
might have a chief medical officer that doesn't have a medical degree? Is that what you're suggesting?
The health officer could end up not being a medical provider, yes. You'd have to have some additional class spec changes later on, but at the end of the day, the candidate that we have before us will meet the current requirements, let alone the changes that were made back in June.
Okay, well, we'll get into that. Again, I wish we had the information before us now and we're able to actually move forward the legislative changes, and given all of the time, it didn't seem, unrealistic, but we then have to learn about how the deputy aspect would be handled, because you're changing the structure, and if the health officer isn't a licensed physician, the deputy would have to be a licensed physician, and we're changing the way that the health officer and the deputy interface. And so the change that you had suggested in June would have a very different application to the change that we're discussing here. And by the way, I'm happy about the change we're discussing here, but I think that's important. The new position, the new hire, is your thinking that you're going to have all of the legislative changes completed and finished before that new hire assumes this new role? Or are you going to hire that person into the existing role and then change the roles for Dr. Bridgers and for the new hire after they're incumbent in the position?
We believe we can move forward with the hiring of the health officer independent of the change to create the chief of public health services. And so that is a class specification change, which we're making to the actual class specification, and we're happy to share that with members of the council. The county attorney, we don't believe it needs a code change or regulation change to change the class specification for the health officer. A lot of the code and regulation changes need to occur to transition the CO, the vacant question A position, into the chief of public health services. So we're not going to slow down the nomination process of the prospective health officer candidate while those things occur, but it would impact much more substantially the transition of Dr. Bridgers into the full-time chief of public health services. That will
So the position, though, will have been changed so that the new hire is going to be occupying a position that no longer includes the
Correct.
chief of public health
Yes,
in it,
class
but some of the
specification.
other changes will not have yet been made, including
Correct.
the reclassification of the other position?
Correct. That's correct.
Okay, well, I look forward to getting more detail and understanding that. The last thing I'll say, and Council President Albernaz noted this, I do think we also need to take a look at the Board of Health and the emergency functions of county government. I think we learned a lot. We did remarkably well, given the challenging environment that we were in and the outdated structures that we had to move forward with, including emergency powers, for instance, that didn't reflect a public health emergency. But I do think it requires us to really think through whether that structure is best positioning us, knowing what we know now, to be ready to respond to the next public health crisis. And that's really what I think our job is today. I know you're doing a postmortem, and we look forward to hearing more about that. But I think on the council side, on our policymaking side, we need to rethink that. As colleagues know, I've been working on that issue. I've had a number of conversations with Council President Albernaz and a number of other colleagues, and I look forward to having that discussion and for us to be able to move forward to build on what we did well, as Council President Albernaz noted, but also to acknowledge that there were some challenges that we faced, some of which were out of our control, but that we can control now for moving forward. So I look forward to having those further conversations.
And I think it's always important to remember that during the first phase of the pandemic, you all and we all were operating under authorities that were given to us by the governor through an executive emergency declaration. And then when that went away, we then had to fall back to the county law. And so the role of the executive, the role of all of you as the Board of Health, all of it changed in the middle. And just, always important to reiterate to the public that there were some things that were happening that were completely out of all of our controls because of the situation. And it's revisiting that second half and what are those powers to the board, to the executive, that I think you just eloquently talked about, because a lot of those executive emergency powers were conceived of during a period of civil unrest, and they're about things that deal with like stopping the sale of handguns, as opposed to what happened in an emergency created by a health emergency.
Exactly. That's exactly what I'm referring to.
Yeah.
Appreciate the clarification. And it demonstrated the interface between the state and the county and the county code and the way that the county is structured. And I think there's some things that we ought to really do a deep dive in and think about for moving forward now that we have a chance to think through it a little bit, not in the middle of a crisis where we're trying to build the plane as we're flying it. I think we used a couple million times.
And I'm sure as Councilmember Rice would tell you from all of his experience with MACO, the majority of county governments have no executive. So of course, state law conceives of commissioners as the Board of Health making all these decisions. It's the handful of the large counties that have the elected executive, and many of these laws predate all of those elected executives. So it's an interesting conundrum to fix state law with all these different local structures with what we need in Montgomery County as a community of more than 1 million people that dwarfs almost every other jurisdiction in the state.
Yep. And your pin is a good metaphor. The state, county, and United States. All right, Council Vice President Glass, followed by Councilmember Rice, and then Councilmember Katz.
Thank you, Mr. President. I want to pick up where we just left off and appreciate Councilmember Friedson's comments, especially with regards to fixing the house while it's sunny, right? And that's what we're really talking about, making sure that policies are in place, and so that should or when another pandemic or health emergency emerges, we're ready for it. And whether those fixes need to be made in Rockville or Annapolis, I appreciate Mr. Madaleno clarifying that the state law is complicated and emergency powers complicate them even further. So perhaps this is a conversation we pick up with our partners in the General Assembly to see what they can do in this upcoming session. But also tied to that, the comments you made at the very beginning regarding the inability to move this process forward because we were unable to count mail-in ballots, another issue, which I actually hadn't equated the two until now, but I appreciate you sharing with us that is why this conversation is happening now towards the end of September and not sooner, as many of us would have liked. I'm going to be brief and say that I appreciate you sharing with us your intention to nominate Dr. Bridgers to that new position. I have my trust and faith in his efforts, seeing what he's been able to do over the last year and before that, and look forward to continuing that conversation. Look forward to hear more about the nominee who soon shall be named once all of the state policies and procedures, and yes, knock on wood, we'll knock on wood again, knowing how this process has beguiled us before. But what I will say, though, about moving forward and trying to modernize this process, reflecting the realities that we've seen, particularly over the last year with a vacant position, I appreciate the thoughtfulness in updating and modernizing these positions without adding any full-time employees, making do with the system that we have, and reformatting and repurposing certain positions so we're not adding more positions. Because I think one of the things that would trouble us even more is by adding more layers to the bureaucracy, recognizing that sometimes that is what has inhibited us and inhibited our ability to move quickly. As good as we did, we don't want to complicate things even further. So that is a conversation that will come once all the other pieces of that puzzle line up, especially with regard to Annapolis and state law. But I'm pleased with this update. Wish it would have happened sooner. Understand why it didn't happen sooner. But it's a conversation that we need to finalize in due time. And with the 2 nominations that you'll put forward, we'll be able to finalize that in due course. So thank you very much.
Mr. President, as you think about some of the changes to be made moving forward, and because of your unique background of having served in the executive branch, the whole idea that position descriptions appear in regulation and that we have to go through a 30-day public comment period on a position description, maybe we don't need to do that. Fine, the position exists in law, and you have the ultimate say in both creating the position, funding the position, but that added step of a 30-day public review process for position description, does that serve us well any longer? And I just throw that out there of thinking about changes moving forward, of maybe that's a dated approach to these sorts of executive positions.
If I could real quick, do you know when that was codified, that requirement?
I don't specifically, and we can follow up with legal staff. However, I would say that the positions that are in regulation are the ones that are defined in the law, and so it does, again, just connect back to those questioning appointments. It's not the broad range, and the broad range of executive positions are not in the regulation and are under the jurisdiction, as was discussed with some of the position changes that the executive branch is able to make. So it is just that question of how much oversight and input the council would have in question A appointments.
Sure. I presume that was codified in a time when there were morning and evening newspapers in which this news would be shared aplenty. So thanks.
I miss those times. Next, Councilmember Rice, followed by Councilmember Katz.
Well, thank you very much, Mr. President. And Mr. Manlino, you couldn't be more correct about there's a lot of conversations at the state level around what's going to happen with health post our COVID pandemic. It's something that's also happening across this country. And as you alluded to at the White House conference, while it was focused on hunger and nutrition, there was a lot of conversation around health in general and what it is that we can take from this pandemic and actually move forward with in terms of changing our policies and procedures. And so from that standpoint, I am excited about some of the things that we can do differently to make ourselves more efficient as government, to make sure that we can respond effectively and also protect employees from some of the politicization that we've seen across the board with our health officers. All you have to do is just take a look at some of the titles that are there across the 24 jurisdictions of those folks that are responsible, and you see the myriad of different ones that reflect why this is so important for us to kind of get right and maintain some sort of consistency so that all of our jurisdictions across the state really have something that's working in their best interest for our constituents moving forward. So I agree with you there. Look, it's been a tough couple of years. By no means does that mean that we couldn't or shouldn't have moved forward quicker. That being said, we're doing what we're doing now, right? There's no need to cry over spilled milk. I agree that the two positions should be separated. I want to thank Dr. Kroll and Dr. Bridgers and yourself for all reaching out to me as a member of the Health and Human Services Committee and discussing this with me some time ago, because that is important to keep us abreast of what's going on. I do think that for something like this, where we all serve as members of the Board of Health, it seems as though some others didn't have that same sort of notification or conversation. So I would just encourage us moving forward that others are also kept abreast of the same kinds of conversations that are going on, because it was incredibly helpful for me and giving my blessing in terms of saying that this is something that I believe is a direction for us moving forward makes complete sense. Obviously, you start with a committee of jurisdiction, but certainly with all of us that are there, that is important to move forward. And I remember these conversations happening back in the beginning of the year about talking about doing something differently. And really, again, want to thank Dr. Kroll and Dr. Bridgers for all of their great work. At the end of the day, look, we tried to do the best we could with the structure that we had, but one of the things we realized is we can reshape this differently. And I do think that all of the conversations that we've had have been incredibly important in terms of how we do that. But let's keep in mind that healthcare in itself has completely changed on its face from what it was before, completely across the board. When you talk about virtual medicine, when you talk about all the things that have happened that have been accelerated beyond what we ever could have imagined in such a short period of time, it is going to be important for us to make sure that we change all of our structures across the board. Your 30-day notifications, just a part of one of the small pieces of what it is that we do. But I will say this, it is going to be incredibly important for us to make sure that our public understands and knows what it is that we're doing. So the sooner that we can get this information and get that out to our constituents, the better. They've all seen and weighed in terms of this process that has happened with us serving as the Board of Health and with our health officer for the county. And so they'll want to weigh in terms of what they saw as some of the good things as well as some of the things that they want to see changed as well. And I think that that's productive. One of the great things that we learned from the conference yesterday was listening to stakeholders from across the nation talk about what it is that they'd like to see happen and gave us some great ideas about how to continue to shape policy to make it better for everyone. We'll want to do that here in Montgomery County as well as across the state of Maryland. And so the sooner we can get that information out to folks, certainly the better to make sure that we have a great process moving forward. So thank you guys for all of your work. I agree again with what my colleagues have said so far. I think that we find ourselves in a really good place, in a great direction, with just a couple more steps that need to be done. So thank you. Thank you, Mr. President.
Thank you. Councilmember Katz.
Thank you, Mr. President, and thank you to all who are working on this topic for doing an extremely good job during the most difficult times. And perhaps it was the most difficult times ever in the history of the United States. I certainly associate with myself with many of the comments already made, and I also want to join the chorus of what a good job Dr. Bridgers and everyone else has done doing and is doing. And I don't want to let it be forgotten that we also need to thank Dr. Gales, who many times did a fabulous job, and the negative received more press than the positive, and that's not fair either. And we certainly thank him for all that he has done and is doing for all of us. And that's not fair, but it's the reality. And we have learned during the process, and we're going to continue to learn. We said many times from this body that when we had to make changes, we were flying the plane, we were building the plane as we were flying it, and that's what happened in a lot of these cases. I agree with the suggestions being made. I think it's understandable. I think we are getting closer and hopefully getting closer and closer to a person filling the jobs, and that's going to be very necessary. We all need to work together to get there. So I agree with the suggested changes. I think they make a lot of sense. I think they give us flexibility where in some cases we didn't have the flexibility that we needed before. And with that, beyond all my thanks, Mr. President, I turn it back to you.
Thank you. Chair Navarro.
Thank you. So just to clarify, so in terms of timing, would it be the next council that would be acting on the legislation, do you think? Because I know, there's not a lot of time left for this particular council. Is that what what would probably happen?
I think we'd like to move forward as quickly as possible, but given, I don't think it would be the next council. I think we'd have this change before that.
December 5th. Okay.
Barring any setback that we can't foresee at this point. Okay. Our intention is to have this in the registry over the next 10 days.
Okay. All right. Yeah, no, I think that is important just because, we have had the privilege of having the deliberations regarding why this change was necessary. Obviously, if you switch into another council, that would add a little bit more time because new members would have to know sort of the background, the reason, and all of that. And I just, because of course we're so used to now having people in person, I would be remiss if I also did not publicly thank Dr. Kroll for all his leadership. I did not focus on the fact that he was on the screens, but it is important to recognize just, what the team has done in general. And I think that this change will definitely serve the county and hopefully will become even a model. And I do want to also thank Councilmember Friedson and Gio, because I know that he, was very much in favor and actually suggesting a lot of this early on. But everyone on the council has just been trying to figure out how we can best move forward. So it's always it's just a collaborative effort, and I just appreciate all that.
Thank you. If I may, Mr. President, I didn't thank Ms. McGuire and Ms. Clemens for the packet and the excellent packet. And just to close with Councilmember Navarro, when I talked to you about becoming CAO, you challenged me to think about making beneficial changes to the county, and hopefully this is one of them. And will be, one of your many legacies of encouraging change and growth across county government to reflect the needs of today and tomorrow. Thank you.
That sounds great. So just to wrap up, you mentioned that we're waiting for a confirmed meeting with the Secretary of Health at the state level. Needless to say, I think the Secretary and his office hopefully understands the urgency. And if there is a delay there, please let us know. Our colleagues in the General Assembly have been tracking this issue closely as well and want to be able to be helpful. And so please let us know if there's anything that we can do to tag team that. And I do want to once again acknowledge Ms. McGuire and Ms. Clemens. Thank you very much for your leadership on this. So this is a to be continued, but clearly we are heading in the right direction and we appreciate the leadership. So with that, our joint committee session this morning is closed.